Basically reach deep pressure and motor. Sometimes also deep pressure anesthesia is given, but motor is not recommended. We don't give to that much of concentration as well as to that of technique. So the motor is always intact. Okay. So just a quick thing that we can see. There's a comparison of early characteristics. If we see on this chart. So what is important here is that this pKa value is important. What is it? This is the dissociation constant. So what happens? The more the dissociation constant, that means this has a higher dissociation constant. There is a higher. This is also higher. And that means the chances of them getting breakdown are more. Okay. That means they are majorly available. Right. If you can see this, this is. If it is gonna less, like you can see here, the dissociation constant is less. Okay, so plasma protein binding is 90% around. Okay, so sometimes we can ask you, so it is what it is. So basically, protein binding may be used as an indirect measure of tissue binding tendency. That means how much it is available for the the area around this protein. That means. If you can see the Prilocaine, that right, this is only 5% plasma. That means the rest 95% is tissue bounded. Okay, and for lignocaine it is 55, tetracaine is 75, bupivacaine 90% with the motor. Okay, and only 10% with the tissue. That means slowly it will get dissociated. So the tissue will have bupivacaine, but with a long period of effect. That is why bupivacaine is long acting, because it's not available to the tissue readily. Okay. You can probably the plasma is gonna have the bupivacaine, and plasma gonna release it slowly. So when it is released from plasma, it will go to the tissue. Okay. So that is it. And with the pKa, the better the bindings are with the tissue, not with the plasma. Okay. Apart from this, I think all good. That we look in the short, and you can also in that category the RT can also comes in. Okay.